Dr. satyabrata, MDDM clinical pharmacologist, and today I am going to discuss on management of rheumatoid arthritis. We all know about rheumatoid arthritis. In rheumatoid arthritis, it has a lots of cause like smoking, alcohol intake, or other genetic causes are there, and it is also an autoimmune disease. And in case of rheumatoid arthritis, there is small joint pains. There might be large joint pain also. There is morning stiffness, and in the thumb there will be pain, and there might be sometimes fever can occur with rheumatoid arthritis, but may or may not be there. And in rheumatoid arthritis, it can affect the heart and other organs of the body, the bones, etc. And it is very sometimes become very painful condition that the patient will be unable to walk. And there is a guideline on rheumatoid arthritis, American College of Rheumatology Association guidelines, and we can follow lots of guidelines on rheumatology to know better on this topic, on the management, and according to the guideline we have to manage. Hi Ricky Coolboy. Hi Maxwell Brown. And we today will know about the rheumatoid arthritis. And we know that rheumatoid arthritis is a more prevalent condition in this worldwide and in India, and it will be very difficult for the management of rheumatoid arthritis, but we can use drugs cautiously for the management of rheumatoid arthritis. Rheumatoid arthritis, we have to first diagnose the rheumatoid arthritis. There are some criteria, and you can learn those criteria from the articles and from the guidelines of rheumatology. And there are lots of drugs we can give in case of rheumatoid. Thank you, Maxwell Brown. You like my channel. Thank you very much. And you should subscribe and watch all my videos so that you can gain a lots. Yes, I am in India. Okay. The rheumatoid arthritis. Now, the rheumatoid arthritis, the drugs, lots of drugs we can use like the NSAIDs, like non-steroidal anti-inflammatory drugs like aceclofenac, diclofenac, ibuprofen, etc. Analgesic, we can use paracetamol, and lots of disease-modifying anti-rheumatoid drugs like methotrexate and leflunomide uh, and sulfasalazine we can use in the management. And sulfasalazine dose is 500 milligram twice daily, uh, and we can increase the dose or decrease the dose according to the patient's condition. And methotrexate is 7.5 milligram once weekly we can give, and according to the patient's condition. And we should monitor the adverse drug reactions of methotrexate like uh, the pancytopenia, etc. Uh, while using these drugs of rheumatoid arthritis, We should monitor the adverse drug reactions and drug-drug interactions, as lots of drugs have to be given for the management of some severe cases. So we can find out the adverse drug reactions and drug-drug interactions, and according to that, we should always manage the patient with the guidelines and with the evidence-based medicine. And another group of drugs that we can use, that is tyrosine kinase JAK inhibitors like tofacitinib. Recently, we are using tofacitinib in management of rheumatoid arthritis. It is available as 5 milligram, and we can also change the dose according to the patient's condition. And other drugs like monoclonal antibodies, we can use monoclonal antibodies like interleukin 1 inhibitors, anakinra, TNF alpha inhibitors like infliximab, adalimumab, and golimumab, etc. And these are some monoclonal antibodies that is called magic bullets, we can use for the management of severe case of rheumatoid arthritis. Infliximab is the monoclonal antibody that is given in intravenous route, but other, that is adalimumab and golimumab, that is given as in a subcutaneous route. And you can go through different guidelines of rheumatoid arthritis, and some evidence-based medicine. You can practice evidence-based medicine for if you are a doctor, you can practice evidence-based medicine, and according to that, you have to treat the patient with drugs, and you have to monitor the adverse drug reactions and drug-drug interactions in these cases, so that the patient will be healthy always. And sometimes the rheumatoid arthritis patients cannot able to walk, cannot able to move, and lots of pain is there. In that case, we have to admit the patient, or we can use methylprednisolone injectables for the management of exacerbations in case of rheumatoid arthritis acute exacerbations. And then we can after using methylprednisolone injection, when the patient will be stable, then we can use all these DMARDs or anti-rheumatic drugs, or monoclonal antibodies, or tyrosine, or tofacitinib, etc. we can use for the management of further management of these patients. And sometimes there are some difficulties of tuberculosis reactivation and other things in with this monoclonal antibody use. So we have to cautious about that and manage accordingly. And 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 in this way we can manage the rheumatoid arthritis, and we should follow up the patient for long term, as it will remain for a long period of time. And we have to give medications till the patient is recovered completely. So we have to follow up these patients and continue the management according to the guideline, and so that the patient will be helpful. And another thing is that after all medications, we have to prevent the disease more than treatment. So for prevention, we can do some moderate type of exercise, and some we can also do physiotherapy, and also we can have some, there is no diet control in this case, but we can live a healthy life with green leafy vegetables and fruits intake, and managing other comorbidities. If there is any hypertension, diabetes, then we have to take the help of diet control and exercise. And we have to know more about rheumatoid arthritis, so that we can also uh, counsel our neighbors, nears and dears about this rheumatoid arthritis, so that if there is anyone suffering from rheumatoid arthritis, they can go to the doctor, and according to the advice of doctors, he or she should be taking medicines and and control his or rheumatoid arthritis. And in this way, we can uh, we can manage the rheumatoid arthritis. So Carlos Henrik, I am okay. Uh, please, please ask any question if you have any doubt on rheumatoid arthritis. The rheumatoid arthritis is a very complex disease, and the mechanism is also complex for the drugs and also for the disease, and the management is very difficult sometimes. But uh, there are also lots of clinical trials on anti-rheumatoid drugs that are undergoing in the preclinical stages and preclinical study, and now also there are some in the phase 0, in the phase 1, phase 2, and some drugs are in phase 3 trials, and they will be discovered after few uh, years, or after few years for the use, and they can come to market if they will show safety and effectiveness in case of management of in case of the rheumatoid arthritis trials, and we can so we should uh, the government or other government organizations, they should more and more do more and more research, so that lots of new and good efficacious and safe drugs will become to the market, so that it will be very easy for the management of rheumatoid arthritis, and also it will help to the society. So drug discovery on rheumatoid arthritis should be there. Otherwise, sometimes there are developing resistant to other drugs, like the previous drugs sometimes may not work for rheumatoid arthritis because of the complex mechanism. So we should always discover new and new drugs that will be effective, and that will be safe for the patient, so that it will be helpful for the society and for country worldwide. Can you ask any question on rheumatoid arthritis? Carlos Henry, Maxwell Brown, Ricky Coolboy, anyone is there? No, I think one person is there, but he don't want to ask any questions. Okay, okay. Then if you have no questions, then I have to leave, and you know some you have gained some knowledge about rheumatoid arthritis. Uh, so we will discuss about, you can go through my channel and subscribe my channel and my videos. There are lots of videos on the rheumatoid arthritis management. You can see the videos and learn more, and also you can go through the articles and the guidelines on arthritis available in uh, Google, in rheumatology, uh, American College of Rheumatology guideline. You can go through and learn more and more from these guidelines, and this will be helpful for you to gain knowledge. So, so this is today's session. That's all for today. and we will meet tomorrow or day after tomorrow again on different topics. And please watch and subscribe my channels and share, like, and we will discuss in further session. Thank you very much. And there is someone in the chat box, but he goes away or she goes away. So thank you very much for listening and watching me. So rheumatoid arthritis is a good topic to hear, and for the management of rheumatoid arthritis patients is really a good job. Thank you. Thank you for listening on rheumatoid arthritis, and we will meet again and again in this forum. Thank you very much. Jai Jagannath.